Hello friends, welcome to our today's lecture on hypertension. Hypertension is a very important disease because it is one of the top most causes of death worldwide, especially in developed countries, because it is a disease closely associated with lifestyle factors like eating habits and exercise, etc. So today we will study about hypertension. The first point to remember is that common misunderstanding about hypertension is that it is a disease of cardiovascular system, but in reality it is a disease of renal vascular system. That is, this means that both cardiovascular system and renal systems are involved in etiology of hypertension. So always remember this point, that it is a common disease of cardiovascular system and renal system. Now coming to definition. So first of all, before understanding hypertension, we will look at what is normotension, because first we should know normal values of blood pressure, then we can only understand abnormal values. So normal blood pressure value is 120 by 80 mm of Hg, and so you can see that there are two numbers, upper one is 120 and lower one is 80. So what does these two number indicate? Upper number is systolic blood pressure, that is blood pressure when heart beats, and lower number is diastolic blood pressure, that is blood pressure when heart is at rest. So there are two numbers, upper one and lower one. Upper one is the pressure when heart beats, and lower one is when heart is at rest. So this is normal blood pressure, that is 120 by 80. Now when we say hypertension, we generally mean that arterial or systemic hypertension. So how it is defined? It is defined as clinically as persistent elevation of systolic blood pressure of 140 to 159 mmHg or diastolic pressure of 90 to 99 mmHg as stage 1 hypertension, and further if it is increased, it is called as stage 2 hypertension, and values for stage 2 hypertension is 160 or above for systolic blood pressure and 100 or above for diastolic blood pressure. So if upper systolic blood pressure is up to 120, like here you can see, if systolic blood pressure is up to 120, it is understood as normal, and if it is between 140 to 159, it is stage 1 hypertension, and if it is 160 or above, it is stage 2 hypertension. So you could have noticed that we have missed one figure, that is between 120 to 140, because up to 120 it is normal, and above 140 it is stage 2, and then stage 1 and stage 2. But between 120 and 140, if systolic pressure is between 120 and 140, it is called as pre-hypertension. It is called as pre-hypertension. That means patient is not yet considered hypertensive, but he is at risk of developing hypertension. So if blood pressure is systolic blood pressure is between 120 to 140, we should monitor patient closely and with regular checkups and lifestyle modification. Same is the case for diastolic blood pressure. If up to 80, it is considered normal, and 90 to 99, it is considered as stage 1, and above 100, it is considered as stage 2. And same case is here, that between 80 to 89, it is considered as pre-hypertension. So systolic blood pressure between 120 to 140 is pre-hypertension, and in diastolic blood pressure 80 to 89 is considered as pre-hypertension. And in systolic and diastolic blood pressure is considered more important. Remember this point. Now coming to classification of hypertension. So basically hypertension is classified into two types, that is primary and secondary, and you already know what is the meaning of primary and secondary. Primary, that has no cause, rather that has cause but the cause is not known to us, and secondary is whose cause is known to us. So primary hypertension is also called as essential hypertension, and obviously in this case cause of increased blood pressure is not known, and 80 to 95% of hypertension cases come under this category. That means in practice, when you see patient, normally it will be a patient of primary or essential hypertension, because most of the cases of hypertension are of primary hypertension. Now secondary hypertension. So the cause of secondary hypertension is known, and it is due to diseases of other organs, and only 5 to 20% of the hypertension cases are under this category. So mostly a cause of hypertension is not known, and in very little cases the cause is known, so it is called as secondary hypertension. And now coming to the both these types of hypertension may be benign or malignant. That is, primary hypertension can be benign, and it also can be malignant. And similarly, secondary hypertension may also be benign and may also be malignant. So what is benign and what is malignant? So literal meaning of word benign is gentle. So from this meaning you can see that this form is not that much dangerous. It is dangerous because hypertension will affect you in long term, but it is not instantly dangerous, that you can control more easily. So it is called as benign. And in malignant means evil. Literal meaning is evil. So this form is considered as dangerous one. And so coming back to benign hypertension, in benign hypertension blood pressure is elevated only moderately, and also second point is that this rise in blood pressure occurs slowly over the years. So you have to remember two things, that there is only moderate increase in blood pressure, and also this moderate increase is not sudden, it occurs gradually or slowly over the years. And 90 to 95% of hypertension cases are benign hypertension. So they may be primary or they may be secondary, but 90 to 95% are benign. Now coming to malignant, this is a dangerous form, and it is malignant hypertension is sudden increase of blood pressure to 200 and 140 mmHg or more. So in malignant hypertension, systolic blood pressure rises to 200 and diastolic blood pressure rises to 140, and this rise occurs suddenly. This doesn't occur gradually over the years, but this rise occurs suddenly. And one point to remember here is that malignant hypertension can occur in both persons, like a person who is previously hypertensive, and also in a person who was not hypertensive, who was normal, but suddenly he can develop malignant hypertension. So why it is considered dangerous? Because the patient of malignant hypertension develops papilloedema, retinal hemorrhage, and hypertensive encephalopathy. What are these conditions? Papilloedema is a condition in which optic nerve at the back of the eye becomes swollen, and retinal hemorrhages means it is bleeding from the blood vessels in the retina. Again, hypertensive encephalopathy means it is general brain dysfunction due to significantly high blood pressure. So, but from here you can see that malignant hypertension is very dangerous, but fortunately only 5% of hypertension cases are malignant. Here should be malignant. Please correct this. This is not benign. This is 5% cases are malignant cases. And in malignant cases, the patient usually dies within 2 years if not properly treated. So it is necessary to diagnose and treat a patient of malignant hypertension as early as possible. So this was it for today's lecture. We have learned about definition and classification of hypertension, and this is very important chapter, and rest of the topic we will see in next lecture. I hope that you have enjoyed and understood this lecture, and if anything is not clear or not understood, you can ask in comment section. Thank you.